Good morning, dental intro. Welcome to day 2. I'm going to go over and do a review with you guys over the chapters. We started with chapter 1, the history of dentistry. So, what is the Hippocratic Oath? You're going to need to know this. This is an obligation to refrain from doing wrong. This is the oath that you take, that you will do everything to the best of your ability, only do things that are trustworthy and in good intention of your patients, okay? Who is the CDC? This is who releases guidelines for infection control for dental health care settings, okay? It's the Centers for Disease Control. J.V. Black. He was known as the grandfather of dentistry. He is actually the one who is the father of operative dentistry. Back a long time ago, back in the 1800s he was born, 1836, somewhere around there. So, long time ago. Horace Wells was the medical discovery of the inhalation of anesthesia. So you'll need to know that. And then, let's see, I gotta get my stuff pulled up here. Sorry about that, guys. And then China is the cleft palate repairs 2,200 years ago. Make sure you know that. And we all know who Leonardo da Vinci is, I hope. We know him as an artist, right? But he also was famous for something else. So he was the first person to find out the anatomical differences between your premolars and your molars. So, a little history there for you. Important dates that you need to remember. In 1882, the first hepatitis B vaccine became available. In 1859, the ADA, which is who? The ADA is the American Dental Association. Know that. Make sure you always know who the ADA is, okay? In 1895, Wilhelm Conrad Roentgen is a Bavarian physicist who discovered what? The X-ray. All right. And then Edmund C. Kells. He was a New Orleans dentist. He's credited with employing the first assistant. So, yay to Edmund Kells, so that we can all be here today, right? This made it respectable for a woman patient to visit the dentist unaccompanied. So, big moves from back in the day, right? Paul Revere. Now, what does Paul Revere have to do with dentistry, right? Like, I would have never known this in a million years, okay? And I love history, so it fascinates me to know history. So, he is credited with being the beginning of science for forensic dentistry. So, we know Paul Revere from, 1775. The British are coming, right? He was the messenger that rode back and forth. Warned him about the right before the Battle of Lexington and Concord. So, interesting fact about our friend Paul Revere here. So, he was the first forensic dentist, right? Paul Revere was known for the identification of the fallen revolutionary soldiers, right? Dr. Joseph Warren, who suffered a head trauma during the war, was identified by a small denture that was actually fabricated by Paul Revere. Is that not the coolest thing? Oh, y'all, I love history. And you know, forensic, it always comes back to dental, right? Always. I don't know if y'all ever watch any of that type of stuff, but I do. Dental records get you every time. Every time. Okay. Anyways, enough about that. And then we go on to chapter 2, professional dental assistant. What is professionalism, right? It's the attitude that is apparent in everything that we do and say in and out of the dental office. So, you know, when you're outside of that dental office, you got your uniform on, you are representing that dental office. You are representing yourself as the dental assistant. So it is important that you always have professional mannerisms. You can't be over at Walmart acting a fool in your uniform or out at a restaurant. It's not going to look good on you. It's not going to look good on your company. And believe me, they will find out about it. I've seen it happen. So make sure that you are always, if you don't want to be identified as that type, as that you work at that office, you better change your clothes before you go out, okay? Not saying go out and act a fool, though, but, I'm just saying. always make sure that you are maintaining your professionalism whenever you're out there, okay? Considering infection control requirements when selecting clinical wear are recommended for good grooming and appropriate dress. So make sure you're bathing, you're putting your deodorant on. If you sweat more than, the average person, it happens. Bring some deodorant with you, bring some body spray with you. Just make sure that you're clean. Don't come to work with your scrubs all wrinkled like you slept in them all night, and make sure that they're pressed and look good, and your shoes aren't covered in mud or anything like that. Your appearance is going to say a lot about you whenever you're working with these patients, and you're going to be up close and personal with them. You're going to be in their personal space, so it's going to, we don't want to be all funky and maybe like we got our armpit all up by them and they're having to smell that all day. Ugh. No, I know I'm crazy, y'all. Just saying, though, it has happened. I've seen it and had to have some conversations with some assistants in the past that have worked for me that we had to talk about hygiene. So it's not the most comfortable thing to have to talk to about somebody because you don't want to hurt people's feelings either. But then you also need to make sure that you are taking care of your patients too. So certification can be attained by passing the DANB. This verifies that you have attained a certain level of knowledge. They're voluntary credentials. They're not required in all states to perform all expanded duties. So it just depends on your state or where you're going to live at, what the duties of you as a dental assistant is going to be, okay? So what are going to be your responsibilities being a dental assistant, okay? Or a DA. A lot of people call it DA. So you're going to make sure that you arrive on time. You stay at the job till it's done. You're helping your coworkers. You're not just leaving instruments over there for them to bag so that you can run out the door at 4:30 unless you guys have that agreement worked out. It doesn't look good on you, okay? Be available and be a team player. Teamwork makes the dream work out there, and one person can't do the job on their own, okay? You're going to need the help of your coworkers. So you don't have to be best friends, but y'all need to get along and do a job together because that's what you're supposed to be doing, okay? And just because you're done with the patient at the end of the day does not mean that your work is done for the day. Make sure that everything's cleaned up, instruments are done, autoclave's clean, you've emptied out the ultrasonic and got it, cleaned out for the next day. Whatever y'all need to do, whatever your duties are by the end of the day, make sure that they're done. Try to keep up on them as much as you can throughout the day, and then you don't have as much at the end of the day so that you guys can get out of there, okay? And you want to also make sure that confidentiality in the dental office is always being used. Do not leave your computer screen up when you walk away. Do not be talking about a patient in public or right outside of the operatory. They can hear you. Those walls are not thin. Some of them don't have doors on them. Okay? And never talk about a patient outside of the dental office. HIPAA, 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 okay? It will come back to you. People, it always finds a way. I'm just going to tell you, okay? What are the salaries of a dental assistant? Well, of course, they're going to vary. And why are they going to vary? It's going to depend on your responsibility, where you're living, and also your experience. So somebody in general might get paid a certain amount. Somebody in ortho might get paid a little bit more, but it doesn't mean that the person in general may have more experience, so they're going to get paid more than somebody just starting out in ortho. Your oral surgery assistants, knowledge is power, and the more you know, the better it is going to be for you out there in the long run. So learn as much as you can as you're out there. Ask questions. Try to get as hands-on. Try to sit in on as much as you can when you're out there. If they're doing extractions or having oral surgery or a denture case, try to see it from start to finish. It's amazing. Get back there with your lab techs and see, if you can shadow for a day and see what's going on out there. There's lots. I loved working in the lab, so I kind of bounced back and forth in ortho from our lab helping out to also assisting with patients. So, and I absolutely loved it. but different strokes for different folks. You'll find what you like when you get out there. So HIPAA. So HIPAA is the Health Insurance Portability and Probability Acts and Accountability Act of 1996. This sets our laws for privacy, just like I was saying before. Make sure that you're not talking about your patients. You got your computers locked. You don't want somebody coming back in and trying to chart behind you either, so don't leave your computer up, because not everybody always has your best interest at heart either. So make sure you're logging off, because if you stay logged in, like, someone can come back behind you and chart. And you know, if you didn't chart it, it didn't happen, right? And we always want to make sure that we're being empathetic to our patients when we're out there, okay? And sensitive. These people are in pain, they're hurting, they may be, you know, grouchy McGroucherson when they come in there, but, you know, you don't know what type of pain they're in. You know, teeth pain is terrible. They could be embarrassed about their dental and oral health, and so you want to be sympathetic and empathetic to these people whenever you're out there, okay? Don't just assume by looking at somebody that they are a certain way or come from some economic background that you're assuming by the way that you look at them, because that's not always true either. So roles of a dental assistant are going to be ensuring compliance with OSHA, okay? Exposing radiographs, providing patient education, and charting. The EFDA duties vary from state to state and personal ability in the dental practice, okay? They can include placing retraction cord, applying topical, making temporary crowns. These are duties that the dentist is going to delegate depending on how comfortable they are with their DA. Like I said, knowledge is power. The more you get out there, the more you prove yourself, and your ability to do these skills and do them in an effective way is going to be better off for you. Because most of the time you're going to be doing a lot out there. So your different employment opportunities, dental sales, teaching at a dental assistant school, or processing insurance claims are outside of just being a dental assistant. So, I mean, there's lots of opportunity out there to do lots of stuff. So, you can start off as a dental assistant, and maybe you want to get into the office manager side of it and work more on that. So, I think it's good to be cross-trained in the dental office. I think the front desk should know what's going on in the back. The back should know what's going on in the front, as well as, you know, in the dental lab. So that's why I say try to get cross-trained as much as you can, see as much as you can, because knowledge is power. Let's see. How do you become a dentist? So you got to complete a dental education in an ADA accredited school to be a dentist in the United States, okay? You have to receive an undergraduate, 4 years of dental education, graduate from a dental university. You will be awarded after that a DDS, a Doctor of Dental Surgery, or awarded a Doctor DMD, a Doctor of Medical Dentistry, okay? Different types of dental practices. You have your private practices, you have your teaching practices, and you have your partnerships. Dental specialties in the ADA, they are going to recognize a total of 9. Let's see. You don't need to know all 9 of these, but definitely look them over. Know that pediatric dentistry treats children from birth to adolescence, okay? I mean, you need to know all these. It's just not for testing purposes. This week you don't, but definitely know what the different practices are, okay? ADA accredited dental assisting programs, their minimum length is 1 academic year, and at the end of the program you may set for the DANB, okay? And then your dental team members, you're going to have your business assistants, also known as your administrative assistants. These are going to be the ones that are going to do your payroll, your insurance, your billing, in charge of appointments and your different office communication, okay? Your sterilization assistants, they're going to be the ones processing all instruments and managing your biohazard waste. I'm getting tongue-tied, y'all. Dental laboratory techs, These are going to specialize in the production of dental appliances. It's a very neat thing. I'm telling you, from start to finish, y'all need to, whenever you get out there, you need to see as much as you can. Normally does not work in the dental office with other team members, but they may be in some. At the general office that I was office manager over, or we actually had a dental lab tech in our office. So anytime I needed something done for a patient, or an appliance fabricated, or say something broke or whatever, that's where my communication went to. I left my office, I went straight back to Kristen, and we had a discussion about, how long it was going to take, what we needed to do to get this done. So, all right, everybody. I don't know if I know everybody's not new that's in intro. If some of you guys have been in procedures previous to this, or have any procedures that you guys need to check off on still, if you do, please message me and let me know. I have people coming in my procedures class Wednesday at 9 this week, and next week we're going to be doing Tuesday and Wednesday at 9 o'clock. We have a lot of skills that we need to get through, so I don't want anybody getting behind. So if you do fall in that category and do need to be coming in and working on skills, please send me a message through Remind, and you can show up here, like I said, tomorrow at 9 to check off with me and work on some skills, or we can do it next week, Tuesday or Wednesday. Just message me and let me know so that I know to expect you to come in. Okay? Y'all have a great day. Thanks.